all doing? So in today's video, we'll be talking about rhesus factor. So let's ask, what is this rhesus factor? Some people don't know about rhesus factor, so we are going to be talking about rhesus factor. Okay, let's define what is rhesus factor. Rhesus factor is the presence of protein in the blood, and we have rhesus positive and rhesus negative. Let's talk about rhesus negative and rhesus positive. Rhesus positive is when there is presence of this protein in the blood, while rhesus negative is when this protein are absent in the blood. About 85% of individuals are rhesus positive and few percent of individuals are rhesus negative. Let's say rhesus negative are precious blood because it's not that common. When it comes to blood transfusion, you see an individual looking for blood because the patient or his relative is a rhesus negative individual. So let's talk about this rhesus factor, the effect in pregnancy. Then the effect in pregnancy is that it poses a lot of a common effect complication in pregnancy. Let's take an example, like a rhesus negative mother conceive. Most of the rhesus factor doesn't affect women during their first time of conceiving, or maybe they had miscarriage. That's why sometimes if you come to ask you, they will ask you, maybe you're a rhesus negative mother, they will ask you, have you ever had a miscarriage before, so that they will know. And this rhesus negative doesn't affect women conceiving for the first time, but in subsequent pregnancy, this is when the complication sets in, because when a rhesus negative mother is bearing a fetus carrying a rhesus positive blood, then this is when the problem sets in, because the mother's blood recognizes this fetal blood as antibody and it tries to fight this blood. During the process of recognizing this blood as foreign body, then there will be blood sensitization. Then when this sensitization sets, many individual women are prone to miscarriage, and it exposes the child to so many complications to the fetus. And this common complication in fetus, we have jaundice, we have renal failure, we have heart failure, we have stillbirth. Some of them might give birth to them and they are already fresh stillbirth or macerated fetus. So let's talk about the treatment of this rhesus negative factor. Most of the treatment are this Rogan injection. This Rogan injection is given within the 28 weeks of gestation or pregnancy, or at least 72 hours after delivery. It shouldn't exceed this limit. So these drugs are given subsequent pregnancy to prevent the exposure of any complication during subsequent pregnancy. So, but the problem now we have about this drug is that it's quite expensive. Due to the high rate of things increasing, the drug is very expensive and individual might not have the finances to buy this drug. And that is a problem. And many women in rural area might find it very difficult to purchase this drug, exposing them to so many complications, miscarriages, and which is something that one can able to prevent or to prevent. So it's very important that we create awareness pertaining this particular rhesus factor. We should create awareness among women so that they can be able to know and understand and to be aware of this rhesus factor. Thank you.